Hello everyone, and welcome to another episode of Ask Dr. Bob. And I have a lot of questions today. We love and appreciate each one that you send our way, but last week I told you we're going to talk about some sun tips because we're in the summertime. Two major tips. What I have found for people who are fair complected, they need calcium. Calcium citrate or calcium lactate and oil. Flax oil would be a good oil to have. The flax oil will take the calcium to your skin because the sunshine will burn up the oil and it creates tough leathery skin if you don't have enough calcium. Maybe 3 or 4 on an empty stomach before you go to bed at night would be a good start and a good protocol. That's probably the very best sun tip I can give you. I do not promote suntan lotions unless you know they're purely organic. Your body needs sun. The next sun tip would be don't be in the sun between the hours of like noon, 3, noon or 6, or noon and 4 because that's when the sun is the highest angle. You're going to get more penetration in your body. Let's talk about some of the tips that people have sent to me or questions. Somebody sent a question from New York with Lyme's disease, and I want you to know that Lyme's disease is becoming quite epidemic right now. When I did the research on the Lyme disease from the company that we work with, which is Biotics Research Corporation, Lyme disease, the aspect of it, they love manganese. So the gentleman who wrote the book suggested selenium or zinc will reduce the availability of manganese because supposedly the spirochetes or whatever causes the issue with the Lyme disease craves manganese, so you take the manganese out. I also would use a product called Agrecept L, which just helps your overall body just control unwanted organisms in your body. I personally take 10 drops of Agrecept every day. Here's another question I thought was quite interesting. What do you do if you suspect adrenal gland challenges? This individual must have read the book, Dr. Bob's Drugless Guide to Balancing Female Hormones. If bright light bothers your eyes, it's a body signal of adrenal gland distress. Sugar will stress the adrenal glands. I want you to eat more protein, vitamin C, red, yellow, or orange bell peppers, any source of protein. Chicken is always great. But we use an adrenal product, a neonatal adrenal product to help support that. The biggest thing is making sure you get to bed at a proper time. You want to be resting. So it's resting, protein, vitamin C, avoid sugar. A blood test that you can do for adrenal gland assessment is your blood pressure sitting and then standing. If your blood pressure drops from a sit to a stand position, it's a body signal to me you have adrenal gland exhaustion. Dr. Bob, I have sciatica, omitting dairy. Would that help? I don't really promote dairy products. I have nothing against dairy products, but for people who have pain, the arachidonic acid in the cow's milk may be a factor for pain for you. So if you have pain anywhere in your body and you have milk, ice cream, cottage cheese, yogurt, cheese on your pizza, you can have pain just because of dairy products. Arachidonic acid is the fat in the milk that causes the pain and discomfort. Dr. Bob, Agave Nectar. They've been having a big debate about Agave Nectar. Should or shouldn't I? We don't promote Agave Nectar. And I don't even use Agave Nectar because I really believe, even though that the studies say that it goes into the body slow. See, what happens in our practice is we have people that come in that have pain. So we always, and we're doing and checking before we do any kind of spinal adjustment if somebody has pain, I always ask them if they have pain, what have they been eating? And we talk about agave and sugar and honey and maple syrup. Not that they're bad, but so many people just love to consume those items. So if you have pain and you're doing agave, back off the agave. So what do you use, Dr. Bob? Try stevia. If I'm going to ever eat anything sweet, organic raisins, and not a lot of them. Because you're going to get pain if your pancreas is compromised. This is a question from a 47-year-old female who recently lost a lot of weight but is hanging out in her stomach. So she wants to know what she should do about it. Well, we have talked about this in Dr. Bob's Drugless Guide to Balancing Female Hormones, body types. The adrenal body type tends to hold fat right here in the midsection. So how do you know if you're the adrenal type or not? Well, does bright light bother your eyes? Do you crave salt? Those are body signals of adrenal gland exhaustion. But you could have this tummy in the lower part of your abdomen because the cortisol level has been elevated, and that's just where the fat tends to deposit. The thyroid body type has fatness all around the body. The gonadal or the ovary type is more down in the buttocks area. So I just wanted to suggest that you could have an issue because of adrenal gland exhaustion. And I talked about the adrenal glands just above that. Dr. Bob, does aspartame cause pain? We don't promote any type of artificial anything. Aspartame, like any other artificial product that you could put in your body, is going to alter physiology. I don't use aspartame, and I know that I've read that it becomes formaldehyde in your body. It can cause seizures and headaches and skin rashes. So it's something you want to really stay away from. Dr. Bob, what recommendations do you have for post-op surgery? I would drink water and eat protein, because your body uses protein as a part of your immune system. Vitamin C is important, and so is sulfur. So let me give you some food tips. Red, yellow, orange bell peppers, excellent. Eggs, onion, and garlic, great source of sulfur. The red, yellow, and orange bell peppers, great source of vitamin C. Chicken. We use a product in our practice called pumpkin protein for those of you that are vegetarians. Rice protein, egg white protein, but your body needs those for the building blocks. It's protein, very, very important. You want to make sure that you have vitamin C and sulfur. Sulfur helps make connective tissue. Dr. Bob, what do you have to say about Himalayan salt? I don't know really anything major about Himalayan salt. We use Celtic sea salt. Personally, I use that. I know there's salts from all around the world. I would suggest that you vary your salts. I know that when people tell me about the Celtic sea salt, it does not impair function in their body. They feel good with it. So monitor your own blood pressure. If you're craving salt, if you have leg cramps, if bright light bothers your eyes, and you use a particular salt and it takes it away, you know your body's using it and it's absorbing it. Next week, what are we going to talk about? Cooking tips. I'm going to give you a few tips that I use on a regular basis just to help the whole cooking experience to be marvelous. I would appreciate it if you pass this information on. We're here to make a difference for each and every one of your lives. Enjoy the summertime.